the journey that led you to do what you do today at Sanofi.
Sure. So, very briefly, I started life as a scientist. I have a chemistry degree. I joined GlaxoSmithKline on their graduate training program, spent a good few years with them, which is where I first started working in vaccines. I've done lots of different commercial roles globally, regionally, and locally, which have sort of all added to my experience. A short stint at Lilly, and then that brought me to Sanofi to head up the vaccines business as general manager for UK and Ireland. And honestly, it's a privilege to lead a team who are so dedicated to bringing innovation to public health for citizens of UK and Ireland.
So, if we turn to our topic today, as has been widely reported on, immunisation rates, including for flu and RSV, have been falling at a troubling rate. So, Rebecca, can you comment on the decline in vaccine uptake and outline strategies for enhancing equitable access and better uptake across all demographics?
Yes, well, there's a lot in there to unpack. So I guess I'll start with something, an issue that's been widely reported and talked about for some time now, and it's also sort of widely appreciated that vaccines are one of the safest and most cost-effective public health interventions. So it's something that we need, as you say, Nicole, to be worried about that decline. The UK adopts the World Health Organization recommendation, which is an uptake of 95% coverage. So that's the sort of standard or gold standard, really, that we should be, looking to achieve. And the decline that you talked about, you're right, it's actually been declining over many years now, at least the last decade. And in fact, last year in England, none of the childhood immunisation programmes actually achieved that 95%, which is something that in the past that it would have done. And there's some good examples of that impact of that decline in coverage rate. So, we've all seen measles in the news recently, outbreaks of pertussis, etc. And these are things that happen basically from having that sort of low coverage, which can be in pockets or it can be nationally. But there are areas where we do see specifically lower uptake rates, lower coverage. For example, in London, and that's where we have seen outbreaks in recent years, certainly in measles. So it's something that many people are very aware of, whether that's NHS England, AXA, working hard, industry as well, to try and recover some of those rates, as you rightly say. And in the UK, we have great data actually, so we can actually measure the uptake quite accurately in terms of what the uptake of that particular vaccination program has been, and that in turn can help you to sort of measure the success of the program, how much impact it's had. So there's a lot of good things on our side, but there's also some things that we need to tackle. One of those things is inequalities, which is again something that's talked about a lot. It's talked about a lot across government. And I think the reason for that is because you have got this difference in uptake of vaccines and this inequity that comes from that difference. And that's multifactorial. There's many different reasons for that. Some of it is around uptake of different groups, like ethnic minorities, for example. Could be Black African, Black Caribbean, Asian, Pakistani groups and communities can tend to have lower vaccination rates. So they might be a group that you might be particularly looking to work with to try and encourage and increase uptake rates there. Regional variations, as I mentioned previously as well. You can have, an uptake rate of say around 60% for example, the maternal pertussis program, which is a maternal vaccination that's to prevent whooping cough. But you might get regions in London, as I mentioned earlier, that have uptake rates of 20-25%, which are obviously much lower. And then obviously that's where problems can occur. And as I said, many multifactorial reasons for this, and I'm sure some of the things we'll probably touch on as we sort of talk, whether that's misinformation or vaccine hesitancy, whether it's accessibility of where you get your vaccines, socioeconomic factors, and also really sort of impactful reasons like trust in government, trust in institutions, trust in your sort of local system. And I think because there's so many different sort of multifactorial reasons, I think there's also a lot that we can take in terms of the learnings from the COVID pandemic, how vaccines were brought to some of those underserved communities, whether it was through community groups and leaders, So there's a lot that we can sort of learn from there and bring that through to sort of really try and tackle some of the issues that we're facing today across all of our vaccine programs, not just the childhood vaccines. And again, as I mentioned, some of those could be about communication, transparency of information, where you access your healthcare. And Sanofi have been working on a project called A Million Conversations, which is a really exciting project, which is all about rebuilding trust with your local healthcare and your healthcare providers, and trying to sort of rebuild that so people engage more in their health systems. So as Sanofi will continue to work with government, with our partners to try and, address that sort of really worrying fall in vaccination rates. But it's multifactorial, lots in there, so lots to unpack.
Lots to unpack indeed. Thank you for that, Rebecca. So, yes, we've been focusing on childhood vaccinations and notably the examples of measles and pertussis or whooping cough. But I just wanted to sort of unpack a few of the possibilities when it comes to barriers to vaccination adoption, to this sort of anti-vax mentality. You mentioned that some reasons outside of the sort of ethnic minority factor or the regional variation factor, other reasons included misinformation, vaccine hesitancy generally, which comes down to sort of maybe perhaps social economic factors or even trust. And you mentioned Sanofi's A Million Conversations program. I was just wondering if we branch out, though, from the sort of childhood specific and take, as you also mentioned, that learning from what can be done as was experienced during the COVID pandemic. What can be done, perhaps definitely inclusive of communication and transparency, to overcome these barriers? Because these barriers, let's face it, they don't seem to be going away, no matter how many programs there are to tackle what seems to be an ongoing and indeed increasing trend to non-vaccination uptake.
Yeah, it's a really good point, and I think a lot of people are really trying to understand that and understand what they can do differently or better. And I know, particularly the NHS England have, a vaccination strategy which is all around, delivery and particularly looking at underserved communities where they can really try and tackle this, hesitancy or lack of uptake. And of course, a factor in that is, some of the anti-vax that we've seen post-COVID, which is, concerning. And I think it's about building trust with trusted sources. So we all have different areas of trusted sources. For some, it might be the NHS, and that's absolutely the right sort of a way to communicate. But there are others where perhaps it might be social media or other or community groups in the community you live in. So I think a big learning of the COVID times was really engaging where people want to engage and building trust and having a trusted source in that right area, no matter where it is, what area of the country you come from, what area of life you sort of, you walk in, that, that everyone has access to this, to the information so they can make choices for themselves accurately.
Thank you. Okay, so we've been very sort of UK specific, as it were. With wariness, perhaps if we look across the pond, so to speak, to the precarious vaccine landscape in the US, given RFK Jr.'s appointment as HHS Secretary, let's not perhaps broach what can be done there at this mad time. But if we look governmentally, again in the UK, coming away perhaps from the health system, though the interconnection there, what role can and does or will Labour's Child Health Action Plan play, aligning as it does, as I say, with the NHS vaccination strategy priorities?
Yeah, so clearly the UK is and has been actually a global leader in the past, particularly in vaccination. And I think with what's happening in the wider world now, it's even more important that we ensure that we're providing accurate and transparent scientific information to the scientific community, all the safety data that's required so that, we continue to operate in that sort of very sort of scientific way, and we can continue as industry to play our part in that by working alongside government. So whether that's us here in the UK working with the UK government or Sanofi globally working, across the globe and the world to support public health, and we absolutely will continue to do that in these times. And Nicole, you mentioned the children's or the Child's Health Action Plan, and it was great to see that at the time and great to see the focus on prevention that brought in. And I think, many of us will be parents. All we want is healthy, happy children. That's what we want, isn't it? And actually, to see that focused on no matter what it is, whether it's mental health, which, can be a concern. I'm a mum of young girls, whether it's obesity or, whatever that sort of aspect of prevention is. I think it's great to see. And it's great to see it's hugely ambitious as well, actually, to have the healthiest and happiest generation of children. Is It's great to sort of set out with ambition. So with that in mind, what can be done? And I think obviously the vaccination strategy, which was published, the NHS England vaccination strategy, published just over a year now, I think December 23, I think it was, really sets out how it plans to, focus on this element of prevention. And I think if I recall back to Lord Darcy's report, which was late last year, he called out that the declining vaccination rates among children was, single biggest challenge to childhood health. So I think there's many things that, all pointing to the same things and pointing to the areas where, we need to focus to improve. And if you go back in and look at the vaccination strategy, that's talking all about improving access, which is obviously key, delivery being more convenient. So again, that sort of helps with uptake, and having this more joined up offering, this holistic family approach, multidisciplinary approach, which again very much fits with the Child's Health Action Plan, which again is this sort of multidisciplinary approach to health of children. So I think there's a lot in there and a lot to be sort of optimistic about in terms of the right things being noted and and to be worked on. And I think also in the NHS England vaccination strategy, it's great to see that their emphasis is particularly on the underserved community. So I think with that strong ambition, providing the right policies follow, then we should be optimistic that that we can head in the right direction.
Thank you. I just want to possibly go into the potential preventative measures slightly more. You mentioned mental health, you mentioned obesity. What else is there when it comes to the criticality of these preventative measures as a means by which to perhaps take a step back from the mal-effects of a decline in vaccination uptake? If we look at primary and secondary prevention, what else is there to take into consideration from everything we've been discussing, and looking at also going into the communities, sort of the preferred engagement zones for a large majority of the population? Surely there is a sort of, outside of the discursive, there is a more educative method that needs to be put in place. Is that so?
So I think education absolutely is key, and you're talking about or asking about the other sort of factors of that health action plan. And of course, we're talking about vaccination today, and of course, vaccination is absolutely a pillar of prevention. And that's why I think again it brings in the opportunity of a wider strategy. So the 10-year health plan, for example, is being consulted on at the moment by the government, and the three shifts that it's talking about, they all fit very much with the focus on prevention. So they talk about the shifts being from hospitals to community, so that's secondary to primary care, better use of technology, analog to digital, and spotting illnesses earlier, so from sickness to prevention. And those primary and secondary preventions are sort of captured in those shifts. And of course, vaccination, of course, is one of them. But as you mentioned, there are others, which could be early detection, screening, early intervention. So it's multifactorial. And of course, it's not just childhood health as well, because there are life course vaccinations. So it could be with flu or shingles or, any of the spectrum across the life course. So from birth all the way through to sort of late adulthood, and all of those programs and all of those interventions and benefits, come through in that sort of thinking about those shifts in primary and secondary prevention. So I think, again, it's all sort of all wrapped up into the same or similar issues. And communication, education is definitely one part, but I think you have to have the whole end-to-end system, kind of lined up so that you can work each part of the system. The delivery and the sort of education is just one sort of middle part of that sort of end-to-end system for the whole thing to work well, to see those benefits.
Thank you, Rebecca. So, all being well, and that end-to-end system in place with science first, miscommunication or malinformation aside, industry working with government, with NHS. My last question today is, what would be your hope for the whole spectrum of the vaccine landscape, from childhood through to adulthood, in, say, a decade's time or so?
There's a huge amount of innovation actually coming in vaccines. And I saw a report recently, which was from the European Pharmaceutical Society. And I think there's something like 100 candidates in development at the moment. So there's this huge innovation in vaccines that's kind of been driven post-COVID, this interest in vaccines. And there's also been huge and significant improvement in health from vaccines. Just to pick a couple of areas, if you look at HPV and the reduction in cervical cancer rates in those who've been vaccinated by almost 90%, reduction in mortality from infectious diseases over the last, say, 40 years. I mean, it's exciting to think what the next 10 years might bring with all of that innovation. And I think for me, for it to happen, I think some of the things that you mentioned, Nicole, earlier, which is let's make sure we've got a great partnership with government. Let's make sure we're continuing to sort of learn the lessons from COVID, which is currently happening through the COVID inquiry at the moment. In fact, we've just completed module 4. And I think some of the lessons learned there have been brought out, have been, look what can be achieved when there's this common purpose that's shared by all, this mission-led approach. So one of my hopes, I think, would be that we can, really harness that mindset of that mission-led approach where industry is seen as a partner, someone who can and wants to help, with these challenges. And then as we work along that sort of pathway, we talked about, let's make sure that things like the infrastructure is in place, that we've got better system of data recording, capturing, so we know who's been vaccinated, for example. Let's make sure that vaccines are more accessible by they're offered in a more accessible way, whether that's at pharmacies or schools programs are easier to access, things like that. And that we've, over that time as well, really rebuilt that trust that we were talking about, so that people do trust in the healthcare system. They want to sort of see the value of vaccines, and it's something that really helps, overcome some of the hesitancy that, that we're at the moment. So at the end of all of that, that vaccines are really sort of valued for the full value of what they can bring. And that's really understood, very widely through across government systems, policies, so that when new vaccines are developed and made available, that they can see, how they can impact, and that they are able to be sort of rapidly adopted and therefore sort of benefit, public health more quickly. So lots of hopes in there, and some things, I think we're kind of working well towards, and some things maybe more work in progress. But there's a lot can happen, and I think we're at a really critical time for vaccines in the UK at the moment, and it would be, great to be to continue to be a global leader in vaccination, and that's something I think we need to double down on now to make sure that continues.
Absolutely. Thank you, Rebecca. It's been a pleasure.
Thank you, Nicole.
And so that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous instalments, at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for pharmaphorum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.